Hi guys, I don't mean to be a broken record on this, but it is my belief that health and education should be provided by the state. They should not be privatised. If the government is incapable of doing this, then it doesn't deserve to be called a government. The Tories have a plan to destroy the NHS, and I think it's so clear that even the most gullible people will accept. 12 years of underfunding, pushing through policies that discourage people from becoming doctors and nurses, austerity and Brexit have and are still having an impact. So you would think the opposition would be on the side of the NHS. Well, here Wes Streeting, the Shadow Health Secretary, says the NHS needs to reform or die. Have a listen.
And of course, part of my diagnosis about the problem is 12 years of Conservative mismanagement. The government will say, look, this is a COVID crisis. These are COVID backlogs that with the biggest public health emergency in our lifetimes, of course, people are waiting a long time for care. And of course, COVID's had an impact. I wouldn't dispute that for a moment. But we went into the pandemic with NHS waiting lists already at a record 4.5 million. We went into the pandemic with NHS staff vacancies at 100,000 and with 112,000 vacancies in social care. So I don't buy this argument that it's all about COVID, that these are just COVID backlogs. I think this is a Conservative backlog, and that the longer the Conservatives are in power, the longer patients will wait. But of course, you'll want to know, well, what would you do about it? Well, I've been pretty blunt about the fact that I think the NHS needs to reform or it will die. We've seen in recent weeks the opinion pages of newspapers full of siren voices saying that the thing that I think we cherish and love about the NHS, the fact that it is free at the point of use, the fact that, you know, when I went through my cancer treatment last year, the one thing I didn't have to worry about was the bill. People are now saying that's unaffordable in the 21st century, that equitable principle of free at the point of need was affordable in the 20th century, but is now unaffordable in the 21st. Now, I don't buy that argument at all, but I think it's in defence of that principle that we need to reform the NHS. And there are a number of ways I think we need to do that. We need more staff in the NHS. I've committed to delivering the biggest expansion of NHS staff in history, training more doctors, more nurses, more health visitors, more midwives, more staff, so that the NHS has the staff it needs to treat patients on time.
Okay. Now, he pointed out here that there was a shortage of about 200,000. 100,000 in the NHS and 100,000 in social care. Okay, but where are these people going to come from? Where are you going to hire these people from? Now, of course, this is about reform of the NHS. This is not about reform of the NHS. This is about giving the NHS the resources it needs. It hasn't had the resources it needs over the last 12 years. It's been underfunded and understaffed. These are explicit policies that the Tories have pushed through. They've underfunded the nurses by cutting their wages, not maintaining it with the level of inflation. So what has happened? Many have left with no intention of returning. They can't feed their families. They can't heat their homes. They're leaving. They can't deal with the workload and the stress that goes along with that. So how are you going to deal with that? You need to bring in people. Now, the Labour Party, unfortunately, have said that they're not going to really change the immigration policies that the Tories have pushed through. They've talked about a points-based system. How are you going to fill 200,000 vacancies if you're going to copy, basically, the Tory policy on immigration? You're not going to reform the NHS. This is not about reforming the NHS. It's about giving the NHS the resources it needs. The NHS does not need to be reformed. It needs the resources that it requests. And when it comes to human resources, I don't see how the Labour Party is going to fix that if they're going to copy the Tory policy on immigration.
Said how we would pay for it. We would abolish the non-dom tax status to raise the £1.6 billion that would be needed to fund that expansion. But I know we'd need to go further. We've got a big problem in this country where we spend so much money in hospitals doing late diagnosis and therefore more expensive and less effective treatment. What we really need to do is get there much earlier, faster diagnosis, faster treatment. That means better outcomes for patients, better value for money for the taxpayer.
Okay, but this requires staff. Where do the staff come from? You can change the rota. You can say, okay, let's say instead of doing these late interventions, let's do them earlier. But that requires staff. And we come back to the problem once again. Where are you going to get the staff from? When the UK was a member of the EU, it had access to doctors, nurses, carers from all over Europe. And it was in competition, of course, and there's always competition for wages. But it was able to bring people in. If you needed people, you could reach out to other parts of Europe, advertise, say, look, we need these people with these skills, and they could easily move to the UK and live there and contribute to the NHS and social care. That's gone now. And the Labour Party don't seem to be interested in bringing it back. They're talking about, as I said, the points-based immigration system. That's going to, by definition, limit the access the NHS and social care have to staff. Now, you're going to say also, well, we're going to fund training. Okay, but training takes time. It takes months to train up nurses, years to train up doctors. The natural response would be to bring people in from abroad to fill the gap until you train them up. There's nothing wrong with training local people within the country. But in order to fill the gap, you need to change the immigration policy. You need to encourage people to come in. When it comes to, well, we're going to get people who are already unemployed, we'll get them into the NHS. But they need to be trained too, and that takes time. And not everyone who's unemployed at the moment wants to be a carer or a nurse or a doctor. This idea, and look, and we have to talk about the point that Wes Streeting has said in the past that he's willing to use the private sector to fill the gap. And this is, unfortunately, the road to privatization through the back door. Because if you bring in private companies, it's very difficult to get rid of them because they start to eat away at the edges of the public sector. Okay, well, we can provide cleaning, for example, cleaning services provided by private contractors. It's cheaper. If there's a problem, you can just sack them and replace them with somebody else. Then you provide other services, secretary services, GP appointment services are provided by private companies. Gradually, you start to see every aspect or many aspects of the NHS being sold off. And that comes at a cost. Who's going to pay for that? You end up with the taxpayer funding these private companies when the taxpayer should be providing a public service. And gradually these services become monetized. Or if you want a GP appointment quickly, well, if you pay an extra few quid, you can have that. That's how these things work. And that's how the NHS will eventually be privatized, bit by bit. And a lot of it has already been sold off. The Labour Party should be on the side of a publicly funded and free at the point of use healthcare service. And I'm afraid with Wes Streeting in charge, it wouldn't be anything like that. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.